Hi everyone, and thanks for joining me on drsue.ca. I'm just wrapping up a very busy clinical day here at my office, and before I left, I wanted to just share with you a couple of little toys or tools, I guess, that have generated a lot of attention amongst my diabetic patients lately. These tools are meant to illustrate why it's so important to control blood sugars for patients who have diabetes. When we have elevated blood sugars, there is a risk of that blood sugar binding to the blood vessels in the backs of our eyes, the vessels in our hearts, our kidneys, nerves in our feet, and elsewhere in the body as well. And by controlling blood sugars to a normal level, we prevent the progression of those complications or delay those complications from happening. This is a neat little illustration to show the difference between a person who's got normal blood sugar and a person who has high blood sugar. Now watch the difference as you look at how the blood cells circulate through the body. This is what it's meant to illustrate. So if you flip it over, you'll see that the normal blood, the blood cells are going much more quickly through the normal blood than they are through the blood of a diabetic person. You see how thick that is and how oozy that is? That's meant to reflect the stickiness of blood when blood sugars are high. So if someone has diabetes and has high blood sugars, where blood is oozing like this through blood vessels and all of those places that we talked about, you can see how that stickiness could lead to complications over time. So the idea is with treatment of diabetes that we control the blood sugars so that the blood is not flowing slowly and thickly like this, but is flowing very nicely like a non-diabetic individual. That's all for today, everyone, and if you do have diabetes, make sure you speak with your physician to make sure that your blood sugar levels are controlled as well as they can be.